as you are, have a look and see what happens. And this is the kind of lift we're going to be having. We're going to go like this. Yeah?
Yeah.
And
perfect.
so that's what we're going to achieve. That is what we're going to achieve.
Yeah.
So what we do is we cleanse and cleanse. So we're going to cleanse the whole face. You'll see me doing this many, many times. Now, I don't care if my patient wears a little bit of makeup, a bit of rouge, or a bit of tinted SPF. It's quite good because
I went to Charlottesville in the airport. I have something.
I don't wear it.
That's good.
But I don't care. Some people say don't wear any makeup. I don't mind if they do wear some makeup because when I cleanse, it's a really nice way to know that I've cleansed really well when this comes completely clean. Yeah?
Yeah.
So my final comb will be about there. So what we do is I put that point of my final comb there. Then I want to go from here.
Yeah.
And I want to go like there, but perpendicular pretty much to my major fold. Yeah?
Good.
So that means if my cone is at point 0, so that's my 0 point will be here. Yeah?
Yep.
So 0 point there. My other thing I do is I do this and see where my
The weaknesses. Yeah. So you're going to go just sort of.
That's it. So this is the bit I want to lift. Here. So put my last comb there.
Yeah.
Line. So I'm going to go just behind.
Yeah.
Yeah.
So we're talking. I'm just looking at the back, so we're talking probably around 40 here.
Yeah, that's good. I like to spray the hair really well because I want more germs in that area. Sorry. You know what it's on.
Okay. I always push it with the cap on the other
You can do.
Yeah.
But
I have looked the other ones, but they're
it's nice.
yeah.
Just put it through. It'll come out.
Look at that. It's very good.
I want it to be, so my entry point will be about there. I don't want to be too close to the head.
Yeah.
So I'm going to make that a little bit further forward, like that. How is that? All right?
Painful.
It is. Is it
What
still
gauge the
painful?
needle is? 30?
Has stopped now?
A bit, yeah.
A bit. So I give it a bit of time, allow that anesthetic to take a bit of effect, and then I do a little bit more. Yeah. Then I'm going to go just get some gold. Yeah. Give it a bit of time. So if you inject really slowly, it becomes a bit more comfortable for your patient. Yeah. So never inject quickly. Same thing here. This is my last one, so I'm going to go there.
Okay.
Right.
And you roughly
Point to tiny amounts here. And then here underneath again. That's it. Tiny amount there.
so bad there.
There, no.
Okay.
This is
1,
good.
2, 3. Sorry, my love. I know it's horrible. But it's worth it.
Good.
No pain, no gain. Exactly. Ready? 1, 2, 3. Well done.
Sometimes you're working down that way.
Yeah.
So it's nice to be able to work both ways. Double it up like that. And so twice. Yeah? That's pretty much the same distance. Then I take my scissors. I like to make these holes smaller rather than bigger. Because if it's too small, I can make a little cut in it and make it a bit larger. But if it's too big, then it's too big and I have to live with it, yeah? And that little bit that I have taken off. Now I want you to turn over away from me. There we go, then I put it like that. And there are my entry points. So I'm going to do that. There, I'm going to stay away. I like to pinch a little bit and do it like that. And then I do just this. I don't stir. Just do that.
Okay.
Just, and you pull it so that it's tightened. Not too much, but you need to tighten those little knots.
Oh, okay.
You have to do it before you start.
Yeah. It's very good.
So, then I put this here, and then what I do is I go into my entry point. Now you see a little black mark there? The black mark must go in.
Perpendicular.
Yeah, the black mark must go in. Get the hair out of the way. There it is. Yeah?
Perpendicular.
Perpendicular.
And then flat.
And then I turn in the direction I want to go. And I'm leaving this there. So my needle is touching just the sterile,
Yes.
not the hair.
Yes.
Yeah? So I go further along. And then I do this. You see how I move from side to side? Pivoting on the entry point.
You're in.
I am.
Oh.
When I move, I keep doing that. That tells me that I'm in the correct plane.
Okay.
Because if I was touching skin, when I did that, it would move the skin. If I was in a muscle, I wouldn't be able to do it at all. So then I move forward a bit, and then I turn. Keep doing that. And then here, I've got a bit of a curvature of the face.
Pinch.
Yeah. So I've got something there. You see that?
Yeah.
I don't like it, so I'm going to change. That's better. You
Yeah.
see?
Yeah.
Because remember, the dermis is not like you see it in pictures. So, yeah, there's my entry point, exit point. Go there, and I go here, and I'm through, and then I pull that through. Yep. And I'm holding that, so I'm keeping all the hair out of the way. That's really, really important. So then I start pulling this, and I feel this little click, click, click. And I go right to the middle there, yeah?
Is there a mark on the middle? Oh, it's just free.
No,
isn't
this
it?
one doesn't. It's just free of anything.
Okay.
So on between the two. I don't throw it away just yet. What I like to do with this before I throw it away, I come over here again, and what I do is I make sure, because I'm going to be throwing this away, I don't need it, yeah? I'm going to make sure there's no hair anywhere in my hole there, yeah? That's really important.
Yeah, I see what you mean.
Yeah.
Yeah.
So I really make sure there's no hair there. Yeah? I want to stay quite superficial now. Okay then? That's it, I can feel it.
So you're happy for superficial? You've got to be, haven't you?
Yeah, otherwise it won't be able to come out. It will go deeper and deeper. And it won't be able to come out.
Because you're crossing kind of temporal.
Yeah, you go in deeper, yeah. You have to be literally just under the skin. Like so. And up it goes again. Yeah. So again, I'm going to do that one first.
I'm going to come on this side.
Right. So again, straight in my hole. I'm not using any pressure at all to go in, because I don't want to create a different hole to the one I made. I want to go into the hole that was there. Yeah.
Okay.
And once it goes in without any pressure at all, I go along. Again, I do my little moving about.
Just say that's superficial there because of dimples.
No, that's fine.
Okay.
It's moving quite a bit without pulling the skin. That's beautiful. That's good. Going all the way down here to my exit point. It's about there. I use my cup. And then you're able to go there.
Would you normally just put a piece of gauze over the hair here?
You can, I do, yes.
Yeah.
Just to be, or
Move your sterile.
no, my sterile. That's it. So now you're touching the blade part of the hair. You're aiming for this area now. Okay, perfect. Move forward. Not to be too deep. So if you keep that sort of in your mind's eye, then it's much easier to go in the right direction. That's it. Very good. Nice. Very good. You're in exactly the right place. That's it. Keep going. Take that finger away from there.
I know, I can't help it.
Because that finger is actually compressing this,
Yeah.
so you're fighting your finger
I
to
know.
go through. So it doesn't help you. If you want to put it lightly here, put it
Okay,
very
so
lightly.
just a tunnel.
Just lightly, yeah, just very lightly.
Put my back a little bit superficial there.
Yeah. Okay, take your finger away. Last person.
You happy with that?
Oh, yeah.
Sorry, lovey.
Okay, now. Move from side to side, let me see. That's good, you're
Yeah.
not moving any of the super.
It's just a
super
little
tissues, yeah.
thingy, so I'm gonna go
Not
just past
beyond,
that.
past
Yeah,
the, about 1 centimeter past that, you're there.
I am there now.
Okay, that's it.
I need a little head. What on
All that there, just pull.
yeah.
Don't be afraid. And as you're holding that, with the back of your finger, put a bit of pressure there and pull. That's it, one more. That's it, you're there. Very good. Don't force it, make sure it just drops in. That's it. Turn in the direction that you want to go. This is a little bit easy. That's it, because you've got the other one there,
Yeah.
which guides you. You want to be near this area here. So when you, the first one is the most difficult one to find where you're going. After that, the first one is like your guide to your next one, because it's going to be right next to that one, yeah?
On top.
Very good. Very nice.
Can't help it with that blinking finger of mine. You okay, lovely?
Just with the pressure.
Pressure
You're
is
doing
good.
really well. You can come back. You're dead good, won't you? Onto this side.
What I normally do is I push that pushing, and you're doing now, I do it while this is there.
Yeah, to stop.
Because the hair doesn't get in the way.
Okay.
So do that while, and then you take it out and you've got a lot more needle to grab
hold of.
That's
Yeah.
it. Take it off completely now. That's it.
Yeah.
Take it off. You see?
Yeah.
You see, you should be able to see that
Yeah.
little curve all the way down. And that tells you
Not
you're
the
in
points.
exactly the right place.
Yeah.
It's another way to check that you, so if you see that little curve over top without it being too sharp, or you can see it, you can lift it, that means you're in the right place. That's beautiful. So keep going, you're almost there. You're at the last cone, just go a bit further down, 1 centimeter from the last cone. That's where you want to be.
What a mole, is it? I don't want to go through that one. Oh, no, it wasn't. Just making sure. Yeah, we're fine. Thank you.
Nice. Very good. Through. That's it. I think you're there. You're definitely there. That's it. Let's grab this off. Very last one going through. Hold this like that. Not pulling, just holding it. I'm pushing back. See how far back I went?
Yes, yeah,
And then I cut.
yeah, that's fine.
Nice.
Okay.
You see?
Yeah.
Because then there's no way you're going to cut the skin that way. Push back, really back. Keep the tension. Cut. Go. Perfect. All right. Pull it again.
You've got
Here.
such beautiful
I know, it's
hair.
very thick.
Oh wow, it really is.
Okay.
Trying to not cut any of your hair.
Oh well, you cut one or two, it doesn't matter.
We'll go back.
So don't pull that way, don't pull the opposite way, that's it. and then go to the end and then move in and cut. You need to press the skin.
Yeah.
You have to be really, that's why I say you have to be really almost closed completely. Keep the tension good, push back and cut. So run these entry points here. And a little bit of minor exit points.
Thank you.
Yeah.
No bruising.
No, you little tiny bit of bruising I think here, but yeah, a little bit of
Thank you.
You did so well.
Thank you.
You
Just
did.
fell asleep.
Right, hello, I'm surprised, yeah, hello. Way to go.
How did it feel?
Very good.
Yeah?
I feel tighter on my face.
Hi, so I've attended the thread lift training. It was silhouette soft and also the spring thread training here at the course, Cosmetic Courses, and it was brilliant to be fair. I was a bit apprehensive travelling down from Liverpool, thought, will I find the place, how's it going to be, you know, but everything ran really smoothly, all the staff are lovely, hands-on experience, a whole depth and of decades of knowledge with my tutor, so yeah, highly recommend, and I'll be back. It's really, really good.